Darren, I've never met you, but I'm interested, to hear what you have to say about um, cybersecurity. I see you're a principal security consultant at Quorum Cyber and chairman of CyberScale. Obviously important to all of us, not least because of what happened at Guy's and St. Thomas's. I don't know if you'll be mentioning that, but of course, we read in the papers about how devastating cyber attacks can be,
Yep.
and the perturbations are far-reaching. So, Darren, welcome, and over to you.
Thank you. Nice to meet you, David. And I'm glad I caught the end of your session because there's a few things there that probably will resonate and feed into this session a little bit. So it's quite a nice link. Yeah, good afternoon, everybody. Thank you for sparing some time and coming along to this session. Hopefully, you'll find it interesting. So I'm going to talk about cybersecurity from a health and care perspective. It's something that I've got some experience in, working in various NHS trusts over several years, but also across lots of other sectors. So I think there's always things that we can learn from one sector to another. So hopefully we'll bring some of those things in. I'm going to let me just see if I can move my slides on. I'm going to start.
Oh, sorry to pause you there, Darren. You're not sharing your slides at the moment.
Am I not? That's not helpful, is it? Right.
Just before you get into the flow.
Yeah, thank you for that. That's good for you to tell me that. All right, let's just do this one, and we are on this screen. Hopefully.
There you go. You're good to go.
Perfect.
Right, good. Thank you. Right, let me just move this one across here. Okay, so I'm going to start off with an apology, and that apology is that if you've come to this session with the expectation that I'm going to give you a kind of silver bullet, I'm going to give you the 3 things that every healthcare organization needs to do, or I'm going to provide you with a link to some AI magical solution that's going to solve all your cybersecurity problems, I'm going to have to disappoint you. I'm not going to be able to give you those, I'm afraid. And part of the reason for that is what one of the things that David was talking about at the end of the last session is that every organization is different, and the cyber threats and vulnerabilities that every organization faces is different, and even across the same sector they tend to be different. And obviously the more or the less consistency you have across those organizations in terms of systems, but also the nature of those different environments that you're in terms of people and the services provided are all different. So cybersecurity is always going to be different for every organization. What I'm actually going to focus on in this session is a little bit around how we think about cybersecurity. And I was kind of really pleased to see, I had a look through some of the people who were signed up for this session, just the sort of titles. And I was really encouraged to see that there was people from lots of different disciplines within healthcare. So we've got executives, we've got clinicians, we've got students, we've got people in information security, and that's really encouraging because I hope that everybody will be able to take a little bit from this. And it actually, from my point of view, dealing with cybersecurity and information security and privacy, all of those groups, all of those functions need to work together to make that successful. So what happens typically, I think, in a lot of organizations, and this is not just in healthcare but around a lot of organizations, is that we know there's a cyber risk. We hear it all the time. We hear about data breaches and all of those things. And so possibly we bring in some people, we bring in some expertise in those areas. And quite often they'll start focusing and looking at some vulnerabilities of systems. They'll look at what the systems you have, and they'll start to put some things in place. And then we carry on doing that, and that's great. And then we get to a point where actually we've probably put some fundamental technical controls in place. We might have put some process-based controls in place as well. But we get to a point where we've sort of reached the limit of what we can do there. And actually the things that we need to do to move it on and make security more effective from that point are more people-based, they're more policy and process-based, they're more risk and governance-based. And And I think the root of that is the way that we think about cybersecurity. We think about systems, we think about data, and obviously all of that is really important. But managing cyber risk, and I've put cyber in brackets, is about managing risk, right? And that's something that we all do. We all have that that part of our role is thinking about risk. So whether it's a cyber risk, whether it's the risk to IT systems, or whether it's the risk to patients and the care that we give them, and the services that we can provide, we all think about it. But when it comes to cybersecurity, we don't necessarily line it up. So there's a bit of that kind of siloing that I think, David, you were touching on in the last section as well. So need to step back a little bit and look at that, and actually think about what is it when we think about when we're concerned about cybersecurity. What's the ultimate thing that it is that we're concerned about? Because we might think that it's systems, but actually, is it systems? So if you look at these sort of two lenses where people, two lenses of focusing, we've got the information security lens on the right. So that would be, you know, someone like me coming in, and we're looking at data integrity, we're looking at system security, we're looking at preventing breaches and malware and ransomware, we're looking at technical defenses, and all of those things. That ultimately we're looking at, well, how do we keep these systems and data secure? But on the other side, we've got the clinical lens, and that's all about patients. And this is, you know, it depends on the arena that you're in. So if you're in a different type of business, then actually your lens wouldn't be clinical patients, it would be customers, it would be, you know, whatever it might be. So in the healthcare arena, we're obviously looking at how do we protect patient care and trust. So those two things, and then there's priorities within those as well. Come back a second. Just touch on this. I think this is just useful to talk about. So within cybersecurity and information security, we've got several standards and frameworks that can help us. Okay, so we've got DSPT, we've got GDPR and Data Protection Act around data. Then we've got things like Cyber Essentials, we've got ISO 27001, we've got NIS and NIS2 coming, and all of these things are frameworks that can help us decide what we need to do from and put things in place from a cyber security and a cyber resilience point of view. And I'll talk about the difference between those two in a second. But again, I think quite often we'll focus on these things because they're things that we're told we need to focus on. But these are things that are here to help us. They're not necessarily things that are going to make us secure. So there's a difference between compliance and security, and the two things can be interlinked. But if you're compliant with a framework, that doesn't necessarily mean that you're secure, or you're secure as secure as you can be. So a lot of what you get out of these frameworks comes back to how you approach them. Do you approach them as a tool to help and guide you improve your cybersecurity and resilience, or do you approach them as a box that you have to tick in the hope that if you're ticking those boxes, it will solve the problem for you without having too much thought? And I think if you do the latter, you'll be compliant but not necessarily secure. So when you're using these frameworks, it's really important, again, to think about what's the purpose of them. So use them as a tool rather than a sort of be all and end all approach. Back to how we think about security and what the purpose of it is and what the importance is. In information security, we talk about something called CLAA, which is confidentiality, integrity, and availability. So we look at these sort of three pillars, if you like. And I think when we think about, so we think about something like the effect of a data breach. So this is the thing that we all hear about and we're concerned about. We're concerned about data breaches. We'll often, and generally, I think we'll think about a data breach in terms of the confidentiality. So typically it will be, we've exposed, you know, however many million records, patient records, and those records are then available on the dark web for somebody to go and find out, and that can cause harm to that individual, depending on how that data is used. There's all sorts of things that can happen off the back of that, particularly with the sensitive nature of the data. And so it's really important. It's really something that's really important to think about. But if we're thinking about it from a patient care perspective, that is something that's going to be potentially of harm to them, but that's probably down the road a little bit. So if they're not undergoing any type of care at that point, then that's obviously going to be probably the biggest problem they're going to face. But if they are undergoing care at the point that something happens, a breach of the confidentiality of that data is possibly not the most critical thing. Because actually, a data breach, if you look at the definition of a data breach, and this is defined within GDPR as well, it's something that affects any one of these aspects of information security. And one of the really critical ones is the availability. So if we have a data breach that affects the availability of data or systems, we're then talking about something that's probably going to affect patients in a much more acute way. So there's various impacts to that. So I think the thing that I'm trying to get across is that rather than thinking about cybersecurity, and this is a collective thought, so it's not just for the cybersecurity professionals, but it is for everybody across the organization, and we need everybody's input into this. Not to think so much initially about the detail of cyber attacks and how they might happen and what they might do from a technical perspective, but start thinking about it more through the lens of what actually is the ultimate outcome of these things happening. What's that going to do from a patient care perspective and our ability to provide those services? So today we've got some friends. And these are my friends, and I've got my friends that are who cares and so what. And again, you can apply this across every type of organization. So who cares really, we've talked about already. It's actually who are your customers, or who are the people or the organizations that you're actually providing some kind of service to as an organization. Those are the key people that actually care. Now, we obviously need lots of people within the organization to care about things, and there's certain elements of having to educate and take people on that journey sometimes. But ultimately, we want to figure out, actually, if something happens, there's a detrimental effect, who's that going to affect? So that's my first friend. My second friend is so what? And this is really valuable, and I think it's something that is a question that you can ask, and it's a question that we ask a lot when we're looking at defining and managing risk. So go back to, again, comparing those two things, and you think about sort of typically how you would think about something from a different perspective. Cybersecurity perspective would be the security measures that keep sensitive data safe, and that's the confidentiality side. Cyber risk management, which is similar but not exactly the same, and cyber resilience is about looking at the potential impact on patients if a cyber attack compromises the systems. So cyber risk, cyber resilience covers not only the preventative side, but also the resilience side. So how do you, if an attack does happen, if it does get past all of the defenses that you've put in place, how do you deal with that? Do you have a plan for that? So that sort of detail, but underneath that, again, we're going back to actually, what does it mean? What are the concerns from our point of view of providing the services to patients and their care, and what are their concerns? And this is where questions are really helpful. So here's a kind of an example, right? So a very typical thing that would happen from a cyber point of view is we have a phishing email, right? Everybody's familiar with phishing emails. Everybody probably gets, plenty of them every day, both at work and at home in their personal lives. And so the risk there is that someone clicks that phishing email. So what? Right. So that's your first question. Someone's clicked a phishing email. So what? Okay, well, what could happen? And these are not always the same. So you're almost kind of looking at, to some extent, maybe looking at worst case scenario here. This is a little bit of a kind of threat modeling exercise, I guess. But you're looking at, okay, what could happen? What could happen? And starting to drill it down into the effect, the net effect on the people that we're trying to protect. So someone clicks a phishing email. So what? Okay, well, that could lead to somebody going onto that could lead to somewhere where ransomware gets downloaded onto systems. Okay, so what happens then? Because if that in itself might just mean that a system is offline. That might, what does that mean? Well, it prevents access to systems, and if that's broadly deployed, then it could prevent access to lots and lots of systems. But again, so what? Well, this is then where we get to the crux of it at the bottom. There's different types of things that can prevent, right? So it could prevent booking appointments. It could prevent servicing appointments. So people could be turning up for appointments, but we might not know who they are, where to send them, because we can't access that data. We can't access the data that we need to treat them or prescribe medication. And so the ultimate effect of that is that patients are losing access to their immediate and essential medical care. Then now obviously there will be plans in place and resilience in place to do that. So it might not stop it, but it might slow it down significantly. And we've all seen that. We've all seen the effects of those things. So the important thing is that we will work together to look at these scenarios and look at what those risks are and what they ultimately mean. We need different inputs to that, because as an information security professional, I know all about phishing links, and I know about ransomware, and I know how it works, and I know some of the things that we need to do to stop it or to react to it. But I don't know ultimately what those services are and exactly how that might impact on patient care. So I need input from other parts of the organization. I need input from the clinical areas to be able to help me with that. So that input is really important. At the same time, we also have to balance things. So security is a really massive balancing act all the time, right? This is what we do all day. We're doing this. We're just trying to balance. And even when we're trying to manage this risk and we've established what these things are, there's actually a balance to the things that we put in place. And I've seen this a lot, where actually there's some controls or some processes that we might need to put in place to make some of these types of attacks less successful and less likely to happen. But those controls themselves can slow down access to systems. They can make that more difficult. So think about something like multi-factor authentication, which is a very common one. That's a really good way of preventing some kind of attacks and mitigating against those. But actually, it does slow things down a little bit. So sometimes if you put that into a clinical area, then that can have a negative effect in itself. So we've sometimes got risks on both sides, and we need to balance those as well. So to be able to do that, we've all got to have the same focus. We've all got to have the same end goal. We've all got to be looking at what it is we're trying to achieve and what it is we're trying to prevent and protect against. And then if we do that and we work together, then we can come up with the right solutions and the right balance. So things we can focus on, some key components. So proactive risk management, I think, is obviously really key, as I've talked about, and it's understanding what that risk is and what the ultimate risk is that we're trying to prevent. And that allows us to balance, and it allows us to prioritize understanding what those ultimate goals are. We have some things then that are, incident response planning and data breach planning and data backup and recovery, and more around the resilience side. So quite often thinking, make sure we're thinking of the resilience as well as the preventative side. Training and awareness and communication is obviously really, really key. Third parties is again another huge area that we need to put some focus on as part of that as well. So the thrust of my talk, it's really, as I say, coming back to the really kind of root of everything is making sure that we understand the risk, we understand what it is that we're trying to protect and guard against, and making sure that that's the thing that we're focusing on, and then the detail comes underneath that. But if you do it the other way round, you'll be less effective, and we need to take everybody on that journey and get everybody involved in that as well. Thank you.
Thank you so much, Darren. We will share a copy of the slides post-conference. I appreciate you've got a lot of links there to click through for the free advice and resources. If you can put a universal link into the chat box today for anybody to access, that'd be brilliant, but I appreciate that if you can't, and we'll get them circulated afterwards. David, over to you. If you have any questions for Darren or for our audience?
Well, I just had one comment. Thank you very much for that fascinating talk, Darren. I think everyone can relate to lots of what you're saying. I just go back to the the guys in St. Thomas, the most recent healthcare large high profile incident, and one of the so whats and who cares, unfortunately, is often reputational damage, which I mean, you're right to obviously talk about impact on patient care, which is, of course, the most important thing. But it also happens that, and I mean, not just in healthcare, that actually, in addition to the actual, practical injury, there's reputational damage, which I think in private sector can mean massive impact on share price.
Yeah, absolutely. I think in the private sector, that is quite often the key thing. The reputational damage and the financial impact of that is the key thing in a lot of cases. So there's always lots of things. There's always lots of stakeholders, and there's a process to go through to identify those. But it's I guess a lot of it is about just making sure that everybody who's involved comes to a common kind of agreement, if you like, and understanding about what is the really key thing that we're trying to do here.
Yeah. I mean, I guess all I can say from a personal point of view is one of the reasons I promised myself I would never take a CIO role again is because of cyber. Because, taking on a role like a CIO role for a large hospital, you are the first one accountable for an incident. And I mean, cyber to me is just, I don't know what you think, Darren, but cyber to me is just like, it's just a ticking time bomb. It's not an if situation, it's a when. And it's like, I just said to myself, why would I need a job? Why do I need a job where one day this bomb's going to go off on my desk and it's going to interrupt my life, in a big way? Because everyone in the boardroom just looks down the table at you and say, how come you didn't prevent this?
I agree, and I think that's where the resilience side comes in as well, because it's I think when we go into organisations, whatever type of organisations they are, one of the first things we'll look at is almost put the preventative thing to one side and say, right, do you have an incident response plan? Do you know what to do if something happens? Like, not the detail, but do you have a process to follow? Do you know who you need to call in? Do you know who needs to make decisions when it gets to a certain point? And obviously that needs to involve that C-level group, right? Because some of the decisions that you'll be making if you have a ransomware attack, you can't make them at an IT level. They have to be made at a board level. So getting that in place is, often one of the most valuable things that you can do because, like you say, it is in a lot of cases it is it's a when rather than an if. And whilst you put all of these preventative things in place that you're going to do naturally when you start focusing on security, on day one you're pretty much still as vulnerable as you were on day 0. And on day 50, you'll be a bit less, but you'll still have there'll always be some vulnerability. So you really want to know, okay, if something happens on day 2, I need to know how to deal with that.
Can I don't know if I see any other hands, but because I have another, but anyway, I have another question, which is in the NHS. I mean, I'm not sure how, I imagine your company has spent a lot of time in the NHS, but in the NHS, my sense is that a lot of the time, the reason hospitals, well, let's just talk about hospitals, are vulnerable is because the organization, for one reason or another, has not invested enough in its infrastructure, like, upgrading to the latest security patches,
Yeah.
and, the latest operating systems. They haven't invested enough, or they haven't had enough budget to invest enough in bringing up their infrastructure up to scratch, to a minimally secure level. And that, and I think the large organizations, maybe like Guys, but some of these big places, they're sitting on they're sitting on really long-standing and complicated infrastructure where, more often than not enough money has been spent on updating.
Yeah, there's definitely a lot of technical debt, and particularly in those sort of systems that are connected to very expensive equipment, which runs on a piece of software that was written 30 years ago, and the person who developed that software is long gone, and the costs to actually upgrade that, replace that, and the disruption it causes to do that, and the planning required is significant. So sometimes those things have to and this is where the risk management comes in again, right? Because it's really about understanding what those risks are, how those affect those end impacts, and which ones you need to prioritize on. And sometimes you have to accept a risk, and that's okay. And sometimes you have to deal with a risk in a different way. So if you can't replace that piece of equipment or that software, putting some other compensating controls around those things to make it more secure within the realm of where it is, and that's where some of the frameworks actually don't help in some ways. Because if you think about like Cyber Essentials, for instance, if you're very focused on meeting the requirements of that, there's certain things that will stop you with that, sort of from a technical debt point of view, from actually achieving that. Whereas actually, in some cases, you'd be better from a security point of view, focusing on, okay, yeah, we understand that we're not going to be able to get that piece of device or the operating system that's operating that up to a supported level in a reasonable time frame. So what can we do around that to reduce and mitigate that risk and stop it from happening? And so it's about, go back to what I said right at the beginning, sometimes it's about understanding what the ultimate thing is that you're trying to do, but it's also about approaching it from the point of view of, we want to improve our security, and that's what we use the frameworks for, to help us do that, rather than just assuming that if we tick all the boxes, then everything's going to be okay.
Thank you, Darren. Thank you, David. We've just started our lunch break, but I can see Mark's got his hand up. If you would kindly take his question as the last one.
Yeah, of course.
Yeah, fabulous. Mark, over to you.
Thanks, Jade. Thanks very much, guys. It's been really, really interesting. I don't want to end on a downer. It's more of a recognition of the size of the challenge we've got. I just wanted to relate the questions that you're answering there, Darren, regarding security. I used to work, I don't any longer because I've retired, but we're talking about an organization where many of our clinical staff don't attend mandatory training each year. And you put that in perspective, that's why we don't spend enough money on other things.
Yeah,
I
think
that is a systematic problem.
I agree, Mark. I think in my experience, that's if I probably see two big problems just based on the experience that I've had. One is the technical debt side, but the other is that it's that sort of there's almost a battle in some respects of the things that we're trying to do from a security point of view, and the pressures that people are under from the clinical side, and the time and the understanding of the importance. And linking those things together, and it is a huge challenge. I agree.
Yeah. Thank you. Thanks both.
Thank you
Thank you,
all
Rob.
so much.